In this video, we will discuss about bundle branch block. The electrical impulses travel through the heart via a specific conduction pathway. The sinoid atrial node acts as the initial pacemaker before the impulses spreads throughout the atria and towards the atrioventricular node. The depolarization wave travels through the heart's septum via the bundle of His and Purkinje fibers. These are organized into the left and right bundle branches. The right bundle branch depolarizes the right ventricle and the left bundle branch depolarizes the left ventricle simultaneously. The septum is depolarized by the left bundle branch, resulting in the septum being depolarized from left to right. In bundle branch block, the pathway these impulses follow is delayed or blocked. If one bundle is damaged, the ventricles rely on the other bundle to receive and respond to signals from the right atrium. If both bundles are blocked, the heart may beat very slowly, which can require a pacemaker. If one or both of these bundle branches are damaged due to a heart attack, for example, the electrical impulses can become blocked. As a result, the heart beats irregularly. A bundle branch block is when something blocks or disrupts the electrical signal that causes the heart to beat. This block leads to an abnormal heart rhythm. The heart's two ventricles usually contract at the same time, but a bundle branch block delays the electrical signal. Therefore, the ventricles that receive the delayed signal will contract at a later time. Types of bundle branch block. Depending on the anatomical location of the defect which leads to a bundle branch block, the blocks are further classified into a right bundle branch block. It can be incomplete or complete. Right bundle branch block occurs when a disruption happens along the pathway that sends electrical signals to the right ventricle. Then left bundle branch block. It can be incomplete or complete. Left bundle branch occurs when a disruption happens along the pathway that sends electrical signals to the left ventricle. Right bundle branch block causes the left ventricle to contract before the right ventricle. Left bundle branch block causes the right ventricle to contract before the left ventricle, making it harder for the heart to pump blood efficiently. The left bundle branch block can be further subclassified into left anterior fascicular block. In this case, only the anterior half of the left bundle branch, the fascicle, is involved. Left posterior fascicular block, only the posterior part of the left bundle branch is involved. Other classifications of bundle branch blocks are bifascicular block. This is a combination of right bundle branch block and either left anterior fascicular block or left posterior fascicular block. The next is trifascicular block. This is a combination of right bundle branch block with either left anterior fascicular block or left posterior fascicular block together with a first degree AV block. Next type is tachycardia-dependent bundle branch block. A tachycardia-dependent bundle branch block is a defect in the conduction system of the heart related to an increase in the rate of cardiac conduction. Tachycardia-dependent bundle branch block can prevent both ventricles from contracting efficiently and can limit the cardiac output of the heart. In certain situations of excessive or reduced heart rate can cause a bundle branch block known as a rate-dependent bundle branch block. A simple way to quickly differentiate between the two types is to note the deflection of the QRS complex in the V1 lead. In V1, a QRS segment deflected down indicates left bundle branch block, while a deflection up indicates right bundle branch block. In both types, the QRS is wide, more than 0.12 seconds. Pathophysiology of right bundle branch block. In right bundle branch block, the SA node acts as the initial pacemaker. Depolarization reaches the atrioventricular node. Depolarization through the bundle of His occurs only via the left bundle branch. The left bundle branch still depolarizes the septum as normal. The left ventricular walls depolarize as normal. The right ventricular walls are eventually depolarized by the left bundle branch. This occurs by a slower, less efficient pathway. Pathophysiology of left bundle branch block. In left bundle branch block, the sinoatrial node acts as the initial pacemaker. Depolarization reaches the atrioventricular node. Depolarization down the bundle of his occurs only via the right bundle branch. The septum is abnormally depolarized from right to left. The right ventricular wall is depolarized as normal. The left ventricular walls are eventually depolarized by the right bundle branch. This occurs by a slower, less efficient pathway. Causes of right bundle branch block. Right bundle branch block can be either physiological or the result of damage to the right bundle branch. Causes of damage include underlying lung pathology, that is COPD, blood clot in the lungs, that is pulmonary embolism, cor pulmonale, primary heart muscle disease, congenital heart disease, heart structure problems that are present at birth, such as a hole in the wall separating the upper chambers of the heart, that is atrial septal defect, heart attack, that is myocardial infarction, primary degeneration of the right bundle, high blood pressure in the pulmonary arteries, that is pulmonary hypertension, and inflammation of the heart muscle, that is myocarditis. Causes of left bundle branch block. Left bundle branch block is always pathological. Left bundle branch block may be due to conduction system degeneration or myocardial pathologies such as ischemic heart disease. It can be because of myocardial infarction, inflammation of the heart muscles, that is myocarditis, thickened, stiffened or weakened heart muscle, that is cardiomyopathy, valvular heart disease, high blood pressure, that is hypertension. Left bundle branch block may also occur after cardiac procedures which damage the left bundle branch or his bundle. A STEMI presenting as chest pain with left bundle branch block is exceedingly rare. The cause for bundle branch blocks can differ depending on whether the left or the right bundle branch is affected. Sometimes there is no known cause. Risk factors for bundle branch block include the risk of both right bundle branch block and left bundle branch block increases with age. Bundle branch block is more common in older adults than in younger people. Having high blood pressure or heart disease increases the risk of having bundle branch block. In most people, bundle branch block doesn't cause symptoms. Some people with the condition don't know they have bundle branch block. Rarely, symptoms of bundle branch block may include fainting, that is syncope, or feeling as if they are going to faint, that is pre-syncope. If both the right and left bundles are blocked, the main complication is a complete blockage of the electric signaling from the upper to the lower chambers of the heart. The lack of signaling can slow the heart rate. A slowed heart rate may lead to fainting, irregular heart rhythms, and other serious complications. Because bundle branch block affects the electrical activity of the heart, it can sometimes complicate the accurate diagnosis of other heart conditions, especially heart attacks. It may lead to delays in proper management of those heart conditions. Bundle branch block might not need treatment. When it does, treatment involves managing the underlying heart conditions such as heart disease that cause bundle branch block. If patients don't have symptoms or underlying conditions, patients may not need treatment for bundle branch block. Patient may need medication to control other issues such as high blood pressure or heart failure symptoms. If patients have symptoms such as fainting, the provider may suggest a pacemaker. A cardiac electrophysiologist places these devices under the skin of the chest. Wires connected to the heart help it beat at a steady rate. If patients have heart failure or dilated cardiomyopathy, the provider may recommend cardiac resynchronization therapy using a biventricular pacemaker. This type of pacemaker helps both of the ventricles contract at the same time. CRT can help lessen symptoms such as shortness of breath. Patients can lower the risk of bundle branch block and other heart problems by staying healthy and making smart choices. These include eat a heart-healthy diet, get regular aerobic exercise, maintain a healthy weight, manage cholesterol levels, quit smoking and using tobacco products, reduce blood pressure if it is high.